Okay.
Chandra Wilkerson.
Deputy I.
Kim Dickerson.
Mary Thompson.
Tanya Minchie. JC Dickerson.
My head hurts. It must be a tumor or an aneurysm. I have a pain in my leg. It's probably a blood clot. My heart skipped a beat. I'm having a heart attack. These are common thoughts that seem very realistic to someone who suffers with health-related OCD. As someone who has been diagnosed and suffered with this my whole life, I have grown more interested in learning the clinical reasoning behind why these thoughts occur and how they can be managed and or treated. Health-related OCD causes debilitating fears that the patient cannot let rest even after medical testing and expertise. There are countless hours of internet surfing to try and find even just a little bit of peace of mind, doctor visits, and sleepless nights. I will be diving into the depths of the disorder to draw more awareness to the matter. My hope is to educate my audience so that they may be empathetic to someone struggling with OCD. Health-related OCD is a condition that causes constant thoughts of having a serious illness. The International OCD Foundation states that approximately 2 to 3% of the U.S. population is affected by OCD and have health-related compulsions. For someone with this condition, small normal bodily functions may appear as a medical emergency. A simple headache can be interpreted as a brain tumor, and minor chest pains can be interpreted as a heart attack. This disorder is especially difficult because these thoughts do not go away easily. Fears can still persist even after medical testing and doctors reassuring that everything is fine. The brain continues to question, what if they miss something, or what if something shows up later on? This constant doubt is what keeps the vicious cycle of OCD going. Health-related OCD can have serious impact on a person's daily life and mental health. According to psychologist Stephen Phillipson, individuals with health OCD often experience ongoing fears of serious illness, even after medical testing. The anxiety that develops with this is often leads to compulsive behaviors, such as repeatedly checking your body for heart rate, constantly monitoring breathing, and scanning the body for unusual sensations. This constant checking ultimately reinforces the anxiety, making the cycle much stronger. Struggling with this for long periods of time can become both mentally and physically exhausting. The mental load can lead to stress, sleep issues, and difficulty completing normal everyday tasks. However, it is important to know that health-related OCD can be treated and managed. One of the most effective treatments is cognitive behavioral therapy, aka CBT. This type of therapy helps the individual recognize unhealthy thought patterns and learn how to challenge them with more realistic patterns. Exposure and response therapy is another effective approach, and this method gradually teaches the individual to face their fears in an uncomfortable way without engaging in the compulsive behaviors. Part of the therapy is teaching the individual to sit with the uncomfortable thought until it no longer is a compulsion, and responding with uncertainty, like maybe, when the fear pops up. This approach can be overwhelming to some, including myself, as the process is very difficult, but over time it retrains the brain to respond to uncertainty and reduce the anxiety. In more severe cases, doctors may prescribe medication to lessen the intensity of intrusive thoughts and anxiety to make daily life easier for the individual. Often a combo of medicine and therapy is most effective. Health-related OCD can have so much control over a person's life and thoughts, turning normal bodily sensations into persisting fears. But with support and the correct treatment, it does not have to control one's life. By becoming more aware of this disorder, we can be more empathetic and remind those that struggle that they aren't alone and help is always available.